2-inch hole could release over 1,000 gallons in just a couple minutes. Here, it's called the goldfish test, and this was done in 1986. A single point of release was only 1.65 inches wide, a very small hole about the size of a golf ball. And just with that, 1,000 gallons were released in about 2 minutes. That's where the figures I mentioned before. It was traveling at the time about 18 feet per second. There was a wind, but you can see it's ground hugging, and it rapidly expanded. There's unique properties of this acid in terms of its boiling point that even though it's released initially as a liquid, it quickly turns into a cloud. This is actually a picture of the refinery after that explosion in 2015, and natural disasters can't be predicted, but could cause some issues that might lead to a release, as well as intentional acts have been discussed as well. If it's a natural disaster, there's already a great tax on the emergency response teams dealing with, say, an earthquake. The hospital rooms are full.
Essentially what we do is we use some of the modeling results to try to estimate the number of casualties and therefore estimate the volume of medical countermeasures that we would need. We need calcium gluconate in order to treat, and calcium gluconate's been on a national shortage list for a number of years. Burn beds are in short supply.
My name's Katie Butler. I'm representing the Los Angeles County Department of Public Health. I'm a board-certified toxicologist with over 10 years of experience in health risk assessment and risk management. We support the fundamental principles of the proposed approach that enhanced mitigation and phase-out of modified hydrofluoric acid is called for. We encourage the district to take a path forward that requires modified hydrofluoric acid to be phased out as soon as possible, and does not leave open an option to continue with this outdated and hazardous technology. An accidental release of modified hydrofluoric acid into the community would result in disastrous environmental and health impacts. We are extremely concerned for the community and worker safety, even in light of the mitigation measures presented here today that may prove effective for a smaller leak. We are particularly concerned for a large-scale release as a result of system failures, natural disasters, intentional acts. For example, the cyber attack last year on the Saudi Arabian petrochemical facility.
How is the County of Los Angeles prepared to deal with any disastrous event that should occur?
The hard truth is, I'm not sure that our department would be prepared to respond to a large-scale disaster that has been forecasted in some of the models. And so that's something we need to take a hard look at, the significant casualties that may result from the inability to respond.
It is uniquely hazardous to health. It is not just an acid that burns, but it does, once it gets on your skin, it does penetrate into your body and actually attacks your bone structure. There's just some pictures here. It does require immediate treatment, and it does require specialized treatment.
My name is Dorothy Moore, and I'm a physician with 10 years of ER experience. And I urge you to keep in mind the University of Texas Emergency Preparedness presentation that was held in September. Remember, they practice for the worst reasonable scenario. He mentioned 500 patients would overwhelm his hospital, and there's a limitation on the number of burn and ICU beds, not to mention the national shortage of calcium gluconate. Locally, there's only enough for 40 patients, they calculated at that time. Even if you survive, there's permanent scarring. I told you about the difficulty determining actual exposure versus asthmatic or the worried well with such insidious initial symptoms of cough and sore throat. When time is of the essence for treatment, this is a triage nightmare. I know workers do a great job, but also consider the trucking corridor. I know it's low probability, but too high a risk. Children are the most susceptible, and this is something predictable and preventable.